Hello everyone, myself Dr. Anjana KM, PG resident, Department of Kaumarabhrithya, Parul Institute of Ayurveda and Research, Parul University. Today I would like to speak on a topic that concerns health, development and future of every child. The importance of breastfeeding and how it is prioritized over the formula feeding. Let's start with a simple question. Daily, we will see the advertisement of many baby toys, baby type diapers, baby dresses, etc. in our TVs. But have you ever noticed a TV commercial based on an infant feeding bottle or infant formula feeds? Definitely no. What may be the reason? There is a very important reason for this. The Infant Milk Substitute Act of 1992 bans all companies with advertising all subjects related to infant feeds, bottle feeding, and the infant foods. The government made this law because it recognizes a simple truth. Mother's milk is the absolute best food for baby and no company should convince the parents otherwise. Even so, things are changing around us. Many mothers are prioritizing formula feeds over breastfeed. What may be the reasons? The reasons are many. Many mothers have to go back to their work immediately after the delivery. So, when they go to their work, they will not get sufficient space or the clean area for pumping or giving the breast milk. Other mother worries that they are not producing enough milk and so they are prioritizing the formula feed. In some families they are prioritizing the formula feeds, saying that by taking these formula feeds the children become chubby and healthier. Other reasons include mother's maternal health. Maybe the mother may be very high stress due to this postpartum. Some may be having postpartum depression, or if there is no one to help others. On these cases, also the mothers are prioritizing the formula feed over the breastfeed. By saying this, we should also consider that sometimes the formula feeding is very essential. In some conditions, such as when the adopted baby, twin children or any other multiple children like triplets, then when the mother is having taking any medicines or they are undergoing any serious conditions like cancer and all, in such cases formula feed act as a wonderful alternative and no one should blame mother for using it. However, when a mother is healthy and is able to breastfeed, switching off to formula feeds makes the baby deny the things that are not replaceable for him. However, when a mother is healthy and is able to breastfeed, switching to formula feed means the baby is missing out the things that is irreplaceable for him. To truly understand why the breast milk is gold standard for the babies, we must know the contents in this breast milk. First of all, it contains a protein called whey protein, which is essential for the digestion of their tiny stomach. Carbohydrate present in the breast milk is lactose, which is suitable for the infant energy and its digestive metabolism. And the other two fatty acids, DHA and ARA, present in the breast milk is very essential, or they act as a building block for the development of the brain and retina and their brain cognition. Breast milk contains living antibodies and immune cells that act as a first natural vaccine that protect the babies from germs, bacteria, and other viruses. Let us see the content of the formula feed. Formula feed contains the protein called casein, but it is not as digestible as the whey protein present in the breast milk. The carbohydrate present in the formula feed is sucrose added with the lactose, which has the chances of making baby to getting obesity or the diabetes in their future life, and they lack the DHA and ARA, which are essential for their brain cognition. Formula milk completely lacks the living antibodies, immune cells, enzymes, and hormones that are essential for the kids. The factory made product cannot copy the all things present in the breast milk. Because the breast milk is common, many myths are spread around us. Myth 1: formula feed babies are chubbier and they are healthier. This concept is entirely wrong. Chubbier does not mean healthier. The heavy casein protein and the combination of glucose and sucrose makes the baby look chubbier, but there is a chance of obesity and the diabetes in future by using this milk. Myth number 2: formula feeds and breastfeeds have same digestion in children. It is also a wrong. We can clearly see in their stool patterns and their digestive capacity. Babies who drink breast milk have easy bowel movement with soft, smoother stool consistency. On the other hand, when the formula fed babies, due to this protein and carbohydrate present in them, have very constipated or pain bowel movements. Myth number 3. Modern formula is identical to breast milk. We have already explained that all the things like hormones, enzymes, and other immune substances are missing in formula feed. As a result, the babies are becoming sick due to diarrhea, ear infections, and other respiratory infections. On the other hand, the babies who are fed with the breast milk have immunity towards these diseases. Myth number 4. Breastfeeding is likely to make the breast saggier and unattractive. The fact is that it is not the act of breastfeeding but the pregnancy that affects the shape, size, and firmness of the breast. During pregnancy, the breast prepare for lactation and as a result, the breast begin to sag. Myth number 5. Mothers with small breasts produce less milk. It is also a misconception. In fact, milk production depends on hormonal stimulation and the frequency of breastfeeding. When we prioritize the breastfeeding, the rewards last lifelong. Organizations such as World Health Organization and the American Academy of Pediatrics recommends the exclusive breastfeeding for a period of 6 months and thereafter the breastfeeding should be continued along with the complementary weaning. Breastfeeding is a powerful form of communication and bonding. The skin to skin contact and the eye to eye contact and the emotional reassurance makes the baby secure, playing an important role in social and sensory development. Breastfeeding also helps mothers in different ways. For mother, it helps her body heal faster after delivery, reducing the weight gained through the pregnancy and lower her long-term risk of ovarian and breast cancer. Our goal today is not to blame anyone. Our goal is to make sure every mother gets the right information, good lactation help, support from family, and the fair environment to work so that she can breastfeed successfully. Breast milk is an absolute food that science cannot copy. Let us all work together to support mother so that they can give their babies the healthiest start in their life. Support breastfeeding. Thank you.